Yiming acupuncture point, also known as eye brightening. Location: 1 cun posterior to SJ17, Yifeng, behind the ear, close to the mastoid process. Needling, perpendicular insertion 0.5 to 1 cun. Caution: be mindful of nearby vascular and nervous structures. Meaning of the name: Yi means to shade, cover, obscure. Ming means brightness, clarity. Together, Yiming implies restoring clarity when brightness is obscured, symbolically referring to eye disorders, clouded vision, or disturbances in perception and consciousness. Functions in TCM: calms the spirit, Shen supports restful sleep, eases agitation, settles dream-disturbed sleep. Brightens the eyes, benefits vision, clears eye disorders, redness, swelling, blurred vision. Opens the orifices and regulates qi, especially effective for ears, tinnitus, and head or sensory issues. Regulates the channels of the head and neck, unblocks stagnation, relieves local pain, and nourishes sensory orifices. Clinical applications: 1. Sleep issues, insomnia, dream-disturbed sleep. Yiming is commonly paired with Onmian, EXHN22, HT7, Shinmen, SP6, Sanyinjiao, and KD6, Zhaohai, for calming the mind. Helps reduce excessive yang rising to the head, grounding Shen, and harmonizing yin-yang. 2. Eye disorders. Used for blurred vision, night blindness, photophobia, and eye strain. Often combined with GB20, Fengqi, UB1, Jingming, Taiyang, and LV3, Taichong, for comprehensive eye support. Its name eye brightening directly relates to this effect. 3. Tinnitus and ear disorders. Beneficial in cases of ringing in the ears, hearing loss, or fullness in the ear. Works synergistically with SJ17, Yifeng, SJ21, Ermin, GB2, Tinghui, and KD3, Taishi. Addresses both excess patterns, liver fire rising, phlegm obstruction, and deficiency patterns, kidney essence depletion. Comparison with neighboring points: Yiming versus Onmian. Both treat insomnia. Yiming has stronger action on eyes and ears, while Onmian is more Shen calming and spirit-focused. Yiming versus SJ17. SJ17 is local for ear disorders and jaw issues. Yiming extends therapeutic influence deeper into sleep, Shen, and sensory orifices. Modern clinical notes. Used in acupuncture protocols for insomnia, sometimes enhanced with electroacupuncture. Reported to improve eye fatigue and reduce tinnitus intensity. Sometimes stimulated with moxibustion to support kidneying in deficiency patterns affecting eyes/ears. In short, Yiming, EXHN, is a versatile extra point that bridges Shen, mind, eyes, and ears, making it valuable in cases where sleep, vision, and auditory issues overlap, such as in stress-related insomnia, eye strain, or tinnitus with anxiety.